The World Health Organization, WHO, estimates that 80% of all sicknesses in the world is attributed to unsafe water and sanitation. Diarrhea kills over 2 million people each year in the world, majority being children. In many countries, schools have very poor sanitation environments. They are unsafe places where diseases are easily spread. Poor sanitation in school buildings impairs the growth and development of a child. UNICEF estimates that 4 million school-aged children in the world are infested with intestinal worms. The solution is to ensure safe water and improve personal hygiene, keeping water sources clean, washing hands before eating or preparing food. It sounds simple enough, but how do you get the message across? The African Medical and Research Foundation, AMREF, is an independent, non-profit, non-governmental international organization. Its mission is to improve the health of disadvantaged people in Africa as a means for them to escape poverty and improve their quality of life. Founded in 1957, AMREF has a set of defined priority intervention areas. These are HIV/AIDS, malaria, family health, training and development of health learning materials, water and basic sanitation, clinical services, and disaster management and emergency response. A coalition between AMREF as the research NGO, a corporate business partner GlaxoSmithKline, the government of Kenya through the Ministries of Education and Health as the quality control experts, the Kenya Institute of Education, and the local community came together. And PHASE, the acronym of Personal Hygiene and Sanitation Education Initiative, was launched. The launch of this initiative is aimed at reducing diarrhea and other sanitation-related diseases that lead to death due to poor hygiene. Traveling into remote areas in Kenya aiming at improving hygiene standards in schools and local communities. PHASE's simple message is that washing hands after using a latrine and before eating contributes immensely to improving the health of a child and that of the wider community. To go hand in hand with washing hands is the footwear campaign. The children learn that a covered foot reduces the chances of getting infections, especially hookworm, by using appropriate technology and locally available materials like worn-out vehicle tires. There are 247 primary schools in Kenya under the PHASE project, from the pastoral communities of Kajiado in the Rift Valley and the fishing communities of Nyanza to the peasant agricultural communities of Western Kenya. In all these areas, PHASE is joining with schools and local communities to create an enabling environment that empowers them for proactive participation. Through their efforts, health is created and enjoyed, and therefore improving the quality of life in these communities. In communities like this in Engaboli in Kajiado, PHASE partner representatives are met with enthusiasm. Communities are viewing personal hygiene and sanitation education as a way of improving their own health. PHASE has assisted over 40 schools in Kajiado, including this primary school, in developing personal hygiene and sanitation education programs. Through PHASE, the parents of Engaboli Primary School have sponsored these advocacy posters with the aim of promoting a health development agenda in the community. First aid has also been introduced in a few pilot schools. Pupils are trained in administering first aid in their schools and homes. PHASE has donated the first aid boxes and the initial drugs. These boxes are now maintained by parents and the nearest health facility. PHASE has initiated and strengthened health clubs in primary schools by training over 14,000 peer educators.
And we're also trying to ensure that what has been done in school is also transferred to the homes.
One of the most unique aspects of phase is the strategy employed in message delivery. Phase recognizes that children are powerful agents of change. Through this model, good sanitation habits and skills acquired by children at school are shared with peers and parents at home and in the neighborhood. Here at Moipei Primary School in Kajiado, 6 peer educators from each class have been trained to raise awareness about health issues at the personal and community level.
The health problem has tremendously gone down, and we attribute that to the good health practices that are practiced at the school level and at the community level.
The peer educators here have been able to pass valuable hygiene education messages such as washing hands before handling food to keep germs away. Food handlers are encouraged to go for regular medical checkups. The project has improved the self-esteem of the pupils as their efforts in educating their peers and parents are recognized.
Sense of ownership is here because the child has a sense of ownership of face. The child is a peer educator and counselor. The child has been able to go out of their way into the society to discuss these issues. Parents have been able to identify themselves with the FACE programs.
The community is now enjoying the benefits of this project.
Vitu kama ugonjwa hatujawahi tena kuona ama imepungua. Kazi kama ugonjwa kama ya kuhara ama ya macho ama pia malaria kwa sababu nyasi ionekani karibu na manyumba.
In Western Kenya, the impact of phase is felt in the 4 districts of Vihiga, Kakamega, Teso and Bungoma. Part of the phase vision for this area is to promote good hygiene and sanitation practices in the community. Phase has supported 100 schools in Western Kenya by improving their basic sanitary facilities. Shimanyiro Primary School is an example of the initiative's effort in building 640 ventilated, improved pit latrines in the project areas. One of the most important aspects of diarrhea prevention is clean hands. The introduction of leaky tins near latrines has ensured that pupils wash their hands after every visit to the toilet. Leaky tins use minimal water and are handy in areas where water resources are scarce. To actively involve stakeholders, the project designed training packages for teachers, education officers and parents and teachers associations. This filtered down to peer educators who empower other pupils on the importance of clean hands and basic hygiene.
The program has been a success in Bumula, and it can be a success in other divisions.
The children have been influential in facilitating the community to adopt good health practices. FACE is using health clubs as entry points in influencing behavior change in schools and the community.
When we compare the schools that are on the program, we have noticed quite a number of changes, especially when it comes to the hygienic standards of the students.
14-year-old Delvin Makani is a member of her school's health club. Through the club activities, she has been able to bring good health practices back home.
FACE has assisted me because we have made a dish rack and we are putting there our utensils. We don't put them down as long time ago how we were doing. Then we have prevented ourselves from diseases.
In many areas, FACE is now linking pupils and the local communities to good health practices. Stakeholders are applauding these efforts.
What we wanted was to find a model where to show that if you improve personal hygiene of the children, the school-going children, and improve the sanitation facilities, then you would have a positive impact of the health status of the children, which would then again influence positively of the educational performance.
To underline this positive trajectory, the project donor injected over 50 million Kenya shillings into this initiative aimed at promoting health.
It was very clear that with FACE we would see very tangible results by ensuring that children in Kenya have a reduction in diarrheal diseases or even death associated with diarrheal diseases. So it was a program where we were able to see a sustainability element and we're able to eventually see tangible results in the communities around it.
And with these new benefits tied to personal hygiene, the FAZE initiative believes the community's viewpoints about sanitation will begin to change.
And the school-going population, who are mainly the pupils, have instilled into their parents the same messages, such that the surrounding communities or the communities in the catchment areas have been able to improve their life.
At Ramba Primary School in Bondo District, the FAZE success story has been replicated in the community. Water is a scarce commodity in this community. Leaky tins have served a dual purpose in such hard-hit communities. Apart from conserving water, they also play a role in environmental protection. Samson Okoth and his siblings are members of their school's health club. They have brought good health practices home, like the introduction of a leaky tin, clothesline and a compost pit. Such homes have really benefited from the FAZE initiative. Parents are extremely happy.
Into their homes, they have seen that there is difference in appearance of the children, punctuality of the children, and their health.
The use of song, drama and poetry in passing health messages has made FAZE a success. The FAZE initiative has witnessed education standards in these areas rising.
Those schools, as we've said, they've realized a lot of improvement, even in the standards of the results, the quality results, because of the child-teacher contact hours.
Perhaps one of the most important activities of FAZE is the development of health learning materials. The simply designed messages are aimed at assisting in the teaching of FAZE and leaving lasting impressions on the pupils' minds. In partnership with the Kenya Institute of Education, the materials were designed to integrate with the school curriculum.
What we are looking towards is that this project rolls out into the country so that all the schools can use those materials. And it will help them because personal hygiene and sanitation is part of what they are learning.
What makes the FAZE initiative unique is the ability to build the capacity of the local people and thus empower them to carry out successful hygiene and sanitation programs on their own.
So really what we do is to train these communities, to train our partners in the areas of personal hygiene and sanitation.
So successful has been FAZE that the initiative has to date managed to reach 200,000 people with personal hygiene and sanitation education initiatives. This is against the initial project goal of reaching a population of 83,000. The challenge right now is to make the initiative an integral program in all Kenyan schools.
So we have seen an impact in Western Kenya, we've seen an impact in Nyanza and also in the Rift Valley. And our hope is that learning that we have gotten would then be broadened into the whole country through the government efforts.
Because of this, FAZE is continuing to broaden its focus with a commitment to improving health standards in these areas.
The way forward is to make sure that Minister of Education have the capacity to continue the activities, to look into ways where we can locally produce a material, the very good material that has been produced at an affordable cost, to make sure that the parents teachers associations are on board so they will continue the activity.
The people of Rift Valley, Nyanza and Western provinces are beginning to understand that to prosper they need a healthy environment where they can directly benefit from their hygiene practices. But what is to be done in other areas in Kenya that have not received similar support? These and other questions remain.
We have accepted that a FAZE must continue because personal health and hygiene is almost a lifelong process.
No doubt, good health practices are being felt by the communities that have come in contact with FAZE. The initiative has proved that personal hygiene and sanitation is sustainable and can be replicated into other areas in the country through government policies. Within this framework, a small project like this will make a big difference in the community so that these children can grow in a healthy, balanced and beautiful environment.